Hi, my name is Chandler and I'm a nurse here at Rose Injectables. The reason you're getting this video is because perhaps you've expressed some interest in Morpheus8 for your body or for your face. Perhaps you've had some questions. Maybe you've already signed up for it and you're just getting started with it. Maybe you have no idea what you're even in for, and so just wanted some information. So let me tell you a little bit about me so that way you know my background. I am a nurse. I'm a trauma nurse initially, and I worked on a lot of patients in Houston at level 1 trauma centers. So gunshot wounds, stab wounds, etc. That was all me before doing all this. A few years ago, my wife took me to a place where we got to learn about aesthetics, and so I've been practicing in aesthetics for over a decade. And over the past few years, I've developed a lot of techniques, a lot of ways that I treat patients from a Morpheus standpoint that has me now speaking nationally for the company that designs it, which is InMode. And then I also train people in office on how to perform the procedure to get the best possible results. And I'm also one of the top 5 in the entire nation for using Morpheus8. I do more than just about anybody in the US. So that's a little bit about me. Rose Injectables, we are somewhere in between a med spa and a plastic surgery office. We don't like to consider ourselves either one or the other, though we do produce long-term results. Our goal is for you to feel better, but not just to feel better, but to also look better so that you feel more confident, more empowered. So that's why we brought all of these treatments directly to you. So our treatments are designed to last over 5 years, if at all possible, if you take care of yourself and you do the right things for yourself. My wife and I started this business because we felt like women deserved a little bit better. For a long time, they haven't really been treated right in medicine, and so we decided, how do we give you your voice back, and how do we make sure that all women feel empowered, that they feel like they have a place where they can call home for not just getting rid of their wrinkles, but if they just want to feel better about themselves. That's where we kind of find ourselves. Let me get into the nitty-gritty about Morpheus, how it works. So Morpheus8, if you've looked at it online or anything like that, I'm going to give you some basics on it. So what it is, it's radio frequency microneedling. So what it is small needles go into your skin, and as they penetrate into your skin, they emit a radio frequency. So that bipolar radio frequency, positive to negative, stimulates collagen development and collagen realignment. So what it does is, this is the way I explain it to my patients, this is your collagen when you're in your 20s. It's nice and in line, everything's lined up. 30s, 40s, 50s, and then what happened? So the way I explain it is, your face used to sit up like this. It was like in a heart shape, like my kids, and then it slowly falls. And our cheeks become our gels become this, and everything just keeps moving south. So how do we reinvigorate the tissue? That's where Morpheus8 comes into play. So what you're trying to do is use that bipolar radio frequency plus the trauma from the needles to cause your body to heal itself. As it heals itself, it re-stimulates that collagen to reproduce itself and to bring it back to life. Now, this isn't one of those quick things that just happens all of a sudden. Just like it took you a little while to have your collagen depleted, it's going to take me a little while to bring it back. So what we do is we treat it over a series of time, usually about 6 weeks apart, so that way your body has time to heal from its initial treatment, and then we do it again so that way your body reinvigorates, revascularizes, new blood flow, new collagen, new growth factors, all the things that go into it, so that way you are maximized. We usually do ours in a series of 3, though that may be just the tipping point where we're just starting off. And a lot of my patients come back every 12 to 18 months for a refresher. I always tell them, don't do this and then stop doing anything. It's kind of like going to the dentist. You don't go to the dentist and then say, I don't need to brush my teeth for the next 6 months. You're still going to need to brush your teeth. You're still going to need to take care of your skin. So that's where we come into play, where we want to help you with that. So the Morpheus is the tipping point. It's the jumping off point to re-stimulate that collagen. And then we're going to add in growth factors, etc., to make it really take it to the next level. And then what you do in between treatments will make it last that much longer. So here at Rose Injectables, I have 2 options for you. I can do face and neck, or I can do your entire body. For those, we have 2 different handles. I have a black handle, this is specific to face and neck, and I have a blue handle, that's a little bit more specific for body. So if you're looking for face, I have 2 options. I've got a 12 pin and a 24 pin. The 12 pin is 12 needles, the 24 pin is obviously 24 needles. The body, on the other hand, is 40 needles. What that means is I can cover more ground with a 40, less ground with a 24, and even smaller areas with a 12. So if you're saying, I just need help around the eyes, well, that's going to be a 12 pin. Face and neck, now we're looking at a 24 pin. Abdomen, cellulite on the legs, something like that, now we're looking at a 40 pin. The depth of needle entrance is going to be dependent on me. I tell it how deep to go, so that way you don't have to worry about it. I can, with a face and a 12 and a 24 pin, I can penetrate anywhere from 1 to 4 millimeters. When it comes to body, however, I can go up to 7 millimeters with a heat index up to 8 millimeters deep. So I can get a lot deeper with those. You don't need that depth on your face. So the 4 millimeters is plenty. In fact, I can go to 5, but that's more for submental area. You just don't have enough real estate up here to worry about going that deep. And then I also dial in the energy based on what your goal is. So if you're telling me I just want collagen stimulation, then I'm gonna dial back that energy because you don't need to melt fat. So if you watch TikTok, if you've watched any of those things that say Morpheus melts fat, they're exactly right. Morpheus does melt fat. But if done the wrong way by the wrong provider, it can do damage. And so that's why I always tell people, do not just go anywhere. This is your face, this is your body. Make sure you trust the person that you're going to. What are their credentials? How many do they do? If they do once a month, you may want to find somebody else, because you don't want this to just be something that they do on the side. You want this to be something that they do all the time, so that way you get the best quality results. So going back to what I was saying, some people don't need fat melted right here. They just need it down here. Some don't need it at all. So I have the ability to program into my machine exactly what depth and what energy I want to use, so that way I can treat all of the areas that you're specifically looking for. So if you tell me I want cellulite on the back of my legs, great, I'm going to dial it in, tell it what to do, and I'm pre-programming the device so that way it treats you exactly how I want you to be treated, so that you get maximum results. How do you prepare for this? So the best thing I would say is stay out of the sun for a little bit, because I would like you to be out of the sun. Though Morpheus does not depend, it is not particular on your skin type. So you can be a Fitzpatrick 1 or Fitzpatrick 6. In other words, white all the way across the melanin spectrum. You can do the whole entire thing and it's not going to affect negatively Morpheus results. So that's the nice thing about it. So you really don't need as much, but I want you to stop your retinols, your tretinoins at least 5 to 7 days beforehand. What that does is it allows your body to heal completely. That way your body is not sensitive at all to the treatment. Also, if you're on blood thinners, please let me know. I want to know that, because since it is needles going through your skin, I want to make sure that we stop those prior to the treatment, if at all possible, so that way you're not bleeding when you come in, or aspirin or anything like that. When you come in with no makeup on your face. I want it nice and clean, so that way we can just get started as soon as we got here. So when you come into our office, what we're going to do is we're going to take a lot of pictures, because I want to be able to provide you with results. I want to be able to show you before and afters that can show you quantifiable data and physical data that shows you that it's working. So we're going to take lots of pictures so that way you can see how it works over time. I have a Visio analysis. The Visio will take pictures and it'll deep analysis of your skin to make sure that we are being able to show you all of that information. After that, I'm going to put you into a gown so that you're nice and cozy. Then I'm going to put a gel all over you that is going to numb. So it's a plasticized gel that I have specifically compounded for me. And what I do is I put it on, it'll stay on you for about 45 minutes. And what that gel does is that's going to get you numb. Because a lot of people ask, does this hurt? That's one of their primary concerns. That's why I put the plasticized gel on you, so that way it penetrates. It'll sit there for about 45 minutes to an hour, depending on you. If it's on the abdomen or legs, it may be a little less time, because I don't need it to numb quite as long, because it's not going to penetrate quite as deep, but also it's a larger area, so I'm going to be cognizant of how much you're actually going to need. After that, I'm going to take you in for the treatment. The treatment itself is going to last anywhere from 45 minutes to an hour and a half, depending on the area. Obviously, for face and neck, we're closer to the 45 minute to an hour. If we're looking at full abdomen, legs, etc., we may be looking closer to the hour and a half. Everything is dependent on you, how you tolerate it, etc. Also, another thing that I do that a lot of places don't do is I will actually inject a little bit of lidocaine just to make it more comfortable. Most of my patients just say, I just feel pressure. I don't feel anything at all. And that's great, because if I want to increase your quality of treatment, I'm going to go a little bit more aggressive than other places will go. I just have that ability, and having done it this many times, I know what I can push. So I want to give you essentially a 2-for-1. So every time you come in and sit in my chair, I want to be able to do 2 treatments at the same time instead of just 1. So really, when you do a series of 3, you really got 6. So that's how I'm going to make that a little bit different. After I inject you with a little bit of lidocaine, then I'm going to proceed with the procedure. And I'll just have you make sure you're super comfortable for the whole entire time. And then it'll be, like I said, about that timeline that I gave you. Afterwards, I'm going to put some growth factor on you to make sure it stimulates that growth and that fibrin, those fibroblasts that come in and stimulate collagen development, get you some new growth factors, and redevelop it. If you are doing the face and neck, I will send you home with a kit that is specific to post-Morpheus treatments, so that way you can maximize your results and really get some heavy-duty growth factors on there. I will recommend recommend a series of skin treatments afterwards, but for the week following, I will tell you, you live with just these. You do not deviate from that because I do not want any thinking outside the box on your own. I want you to allow me to take care of you for that week. So I will give you that to make sure you maximize your results. So for the following week, you're going to use my skincare specifically. After that, I will make recommendations for you, but at the same time, you can go back to your regular skincare. There's no makeup, there's no anything for that following week just because you've got the open channels. I don't want those open channels clogged. I don't want them to get any bacteria or any infections. That's my thing, is I want you safe. That's why I want you just using my products instead of anything else that you would think to use at home. So what does it look like from a recovery standpoint? Well, everybody's different. The younger you are, the faster you're gonna recover. But for most people, you have some redness and swelling for about anywhere from 2 to 5 days. If we go really aggressive, it may be 5 to 7, but typically that 2 to 5 day window is what it's at. And again, it's redness and swelling. It's not like you can't go out in public. You'll still be fine to go out in public, but those days just know that you may have a little bit of redness and a little bit of swelling. It does take up to 6 weeks for it to completely heal, so that's why we have you come back in that 6 weeks, but you will notice results up to 3 months from the procedure. So when we start the procedure, just know that your max results may be 6 months away from today, so that way you have a realistic expectation of what it's gonna do. Positive results afterwards. I have some of the best results, and if you like pictures, please visit our website. You can come in, I have books here, etc., that you can see what does before and afters look like, because I want you to be able to gauge my patients, not just what they can do, but what I can do. So I want you to have those expectations to, we can lighten this up a little bit, tighten this up a little bit, lift this up a little bit, get rid of stretch marks from pregnancy, get rid of cellulite. Those are my realistic expectations with you, but I want you to hold me accountable, so that's where the pictures come into play. I will tell you when you come in if I think, or what I think will be the case, what I expect, so that way you know what can happen. A lot of times my patients come in and they're like, I want to get rid of the saggy, or I want to tighten up the wrinkles, or I want to lose a little bit of this. How do I do all that? But I also want to get rid of the dark spots. Morpheus won't get rid of dark spots, but I usually combo it. I call it my bright and tight package because I want you to be bright and tight, and so I use that with an IPL. We discussed that in another video, but I'm happy to discuss that when you come in. So at the end of the day, your goal and my goal should align perfectly, so that way you get the best possible results. My goal is for you to feel empowered, for you to feel confident, and to feel like you got the best possible treatment. So choose me, because that's why I take care of you to make sure you get the best results.